Hi, my name is Dr. Stacy Aslan. I'm the director of Waterfront Chiropractic Center. Chiropractic office, a wellness chiropractic office here in Huntington, Long Island, New York. And I've been in practice for 22 years. I practice a very specific method of chiropractic called the Gonstead method. And I want to show you some of the changes that we've made in some of our patients' spines. So I'm going to show you one particular case of a patient who is non-antalgic, meaning that their spine was crooked not because they were in pain and had muscle spasm, but because it happened to be crooked. And she did have some symptomatology when she came in to see us. Now, what is important about this is that many chiropractors say that you cannot change spinal curves, that you can't reduce scoliosis. Medical doctors say that about chiropractic very often. Many of them, not all, but many of them, and insurance companies say that you can't, and that's all investigational and there's no proof. Well, here in our office, we do this all the time, as in many Gonstead clinics throughout the world. So, first thing I want to do is I want to show you the first film, and this is the first film that she came in with. You may not be able to see this on the video, but she has a 5mm short leg. She has a 3mm rotated pelvis, and she's got a 6mm rotated sacrum. Her lumbar spine is a scoliosis where it veers to the right, then it comes straight, and then it veers back to the left. We dropped a plumb line from the center of her odontoid process, which should line up over her pubic symphysis, but as we drop this down, okay, you can see how this line falls way off from the center of the pubic symphysis, meaning that all her weight is shifted off to one side. Now I'm going to show you the post film. In her post film, her short leg is now 3mm. Her rotation of her pelvis is now 0, so there is no more rotation of the pelvis, and her sacrum is only rotated 1mm. If we look at her lumbar curve, it is straight, no longer scoliotic. Her thoracic curve is no longer listing to the right, and her cervical curve is also now straight. As we drop a plumb line from the center of odontoid process, we find that the plumb line, although it might still be slightly to the right of the vertebrae, it is falling directly center over her pubic symphysis. Now what I'd like to do is I want to show you them, both of them, side by side, where you can see the dramatic changes in the films. Thank you.